Be audit by Udit. You have been using audit in your case record pro forma, and it's fairly easy scale to administer. It then doesn't take much time. So I'll be covering the basics of it, and we have a role play planned for you to actually see how it is administered. So the learning objectives for this session would be: why do we need to screen? Whom do we need to screen? How to screen using audit or how to use audit, and what to do with the result of the audit, or how to use the audit score to plan further intervention. So I'll move ahead. Okay, as you know, alcohol use in a population can be seen as a spectrum. In the sense, people there are the mildest end of the spectrum and the severest end of the spectrum. The mildest end starts with people who don't drink; they are the abstinent people. Then the up the ladder is safe drinking or social drinking. Then the other three patterns of use are hazardous use, harmful use, and dependent use or dependence, alcohol dependence, what is also known as addiction. These are the problem drinking behavior. I'll give you a brief clue about what is the three different type of unhealthy alcohol use pattern. So the hazardous drinking, which is also known as risky drinking, is when a person is drinking and by his drinking habit is putting him in the risk of significant harm, be it physical, mental, social, or legal. Or if you have to define in another term, it would be someone who is drinking to get drunk or drinking to get intoxicated. Like I drink and I drank so much that I am unable to ride a bike, but I am arguing with my friends to ride a bike and go back home. That is hazardous drinking. Harmful drinking is the higher version of hazardous drinking, and it is more harmful in the sense the person has already experienced harm, either physical or psychological harm due to alcohol use, but he continues to drink. So you have had like multiple episodes of road traffic accident, but you are not stopping your drinking habit. You continue drinking, then you are a harmful user of drinking. Dependent use, when the disease or the alcohol use becomes a brain disorder, it becomes dependent use. It is the severest form of the alcohol use disorder. It is the severest form of the spectrum. In this, there are multiple symptoms that are there that are associated with dependence, like craving, tolerance, withdrawal, salience, use despite harm, and loss of control. Okay, so what exactly is hazardous drinking? It is the drinking habit that puts you in harm's range. No, how can we define it by the amount of drink that people take? We don't have any data from India, but I have gathered data from two famous international organizations. They are based in USA. One is the NIAAA, or the National Institute of Alcohol Abuse and Alcoholism. They define binge drinking to be to be happening when a person takes 5 drinks over 2 hours, and heavy alcohol use when you drink more than 4 drinks every day. For females, it is less. The 4 drinks over 2 hours is binge drinking, and more than 3 drinks per day is heavy alcohol use. There is another organization, SAMSA, or the Substance Use and Mental Health Services Association. It says that it's same thing, 5 drinks on a single occasion. They don't define it by hours. Or for male and for female, 4 drinks on a single occasion would amount to binge drinking. And heavy alcohol use, if you binge more than 5 times in a single month, you are supposedly using alcohol heavily. So that is how they have defined hazardous drinking. Is there any other way? We'll find out in the subsequent slides. Now, why screen? There are 4 basic reasons why we need to screen alcohol use. Why? Because as you already know, alcohol use and other substance use disorders are very prevalent in our country and worldwide. In India, only for problematic alcohol use, about 6 crores people are there who use alcohol problematically, as per the National Drug Use Survey. Substance use and dependence obviously are underdiagnosed, mostly because they are stigmatized and there is less treatment seeking. They remain underdiagnosed. They are seen greater among people who already have a mental illness. And fourth is the increased morbidity and mortality, and ultimately productivity of the country. So considering the 4 reasons, early diagnosis and intervention becomes of paramount importance. In the sense, if you catch them early and intervene, the harms associated with the disease of alcohol use and the progression of alcohol use is going to be halted. Okay, whom to screen? So there are various setups where you can screen people for alcohol use. The first obviously is the primary healthcare setup, and other healthcare setup like the places where you are working. The next is for people who are presenting and their complaint might be related to alcohol use. Now you can see I have given a picture of a jaundiced man. So a person who has come with jaundice, you can actually screen it over that, because alcohol related hepatic diseases are very common phenomenon to happen, so that needs to be screened. Then you should screen in people whose clinical condition might be affected adversely by using alcohol, like let's say for example depression. If you drink, the depression course of depression is going to get modified, and the depression is going to be more severe and more difficult to treat. So there also you need to screen. In prison setting, screening is also required, because in prison setting the prevalence of antisocial personality disorder and substance use disorder is very prevalent, and screening and treating substance use has shown to decrease the crime rate. So there you need to screen. And as part of health promotion, which is the primordial method of prevention of any disease, you need to screen in young adulthood. So be it high schools, colleges, there you need to screen. These are the one of some of the most common clinical situations where screening is used. You can actually try it in any setup. You can try it in your office, you can try it in the school you are working in, you can try it in the in your clinical setup, in a private clinical setup, anywhere you can do it. Okay, so in that sense, screening for alcohol is similar to hypertension and hyperlipidemia. How? Because if you catch them early, you can modify the course of the illness. You can treat, you can give interventions, you can treat with medicines, you can treat with behavioral therapy, and the harm that is going to come with alcohol is becomes minimized. Okay, so early detection and treatment of developmental stage prevent the established disorder and associated morbidity and mortality. In the sense, if your BP remains high, let's say by 140 by 90, and you advise someone to actually cut down on salt, become more active, start exercising regularly, then the development of frank essential hypertension is delayed by maybe another 10 or 20 years. So similar is the case with alcohol use or any other substance use for that matter. If you detect harmful patterns of use and try to intervene over there, the development of alcohol dependence, which is the severest form of alcohol use disorder, is going to get delayed. Now for screening, there has been various instruments that has been in use. One such instrument, most famous instrument, is case, where you ask about cut down, guilt, annoyance, and eye opener drink. And another is mast, which is the Michigan alcohol screening test. This screening test had one problem. They were very efficient in detecting alcoholism or alcohol dependence, but not so much in detecting the other two part of the harmful use of alcohol and hazardous use of alcohol. So there are, I told you, there are three categories of problematic alcohol use. One is hazardous alcohol use, one is harmful alcohol use, one is alcohol dependence. These two scales were able to effectively detect alcohol dependence, not so much for hazardous and harmful use. To counter that or to detect those kind of cases, WHO put in some effort and they developed this test, alcohol use disorder identification test. So obviously it is developed by WHO, and please remember, it is a screening instrument, it is not diagnostic. So whatever interpretation comes from the audit score has to be diagnosed by a clinician. This is just a recommendation or a sort of a screening outcome of the test. It has great discriminatory value between non-drinkers and hazardous drinkers. Someone is scoring uh, above par on your audit score, then probably he will have hazardous drinking. It has been validated in various languages. Sadly, the Hindi validation is continuing. It has not, the project is not complete. It is being done by Dr. Yatan Balhara from MENS. So it probably be completed in few, maybe another 1 year or so. WHO promotes its use in SBI, that is the screening and brief intervention, and SBI RT model, the screening, brief intervention, referral to treatment model. So you screen with audit, then you start your intervention and you refer if needed. It gives a framework for the necessary intervention ahead. Okay, this is the scale. There are 10 questions and there are 5 responses that needs to be given. It is scored in the range of 0, 1, 2, 3, 4. There are last 2 questions have scores of 0, 2, and 4. 1 and 3 are not there. Before we go to the demonstration, there are few rules of administrative audit I'll tell you. First rule is when to administer. When your patient or a client is stable, if he is having withdrawal symptoms, in much distress, or is very anxious, then it is not a good time to administer audit, because it's not going to give you good scores. Then where to administer? You can administer in OPD, you can administer in general or psychiatric hospitals, in prison, in workplace, in emergency, anywhere the patient is comfortable, you can administer. You should begin by saying the following line, that I am now going to ask you some questions about your use of alcoholic beverages in the last 1 year or past year. Are you comfortable in answering the questions? Then before asking the 10 questions, you should explain about what do you mean by alcoholic beverages. That you should say that by alcoholic beverages, I mean the spirits like vodka, whiskey, rum. Then I also include beer, wine, brandy, everything as alcoholic beverages. And if your client is suspected to consume country liquor, you should also mention that, and ask the questions as it is in the same order. That is, you start with question 1, then follow up with question 2, 3, 4, 5. Do not mix the questions. Do not give clarifications about the questions unless your client asks about it. Okay, so with that, I will go ahead to the demonstration directly. Now I have requested Mr. Kiran, my co-worker, to actually play a part of the patient in this CA. Well, let me put it here that all this interview is a part of fiction. There is no resemblance to any person living or dead. So the demo case here is Mr. K. He is a 28-year-old male currently working as a software engineer. He was referred to you for evaluation regarding his alcohol use from the emergency department of Nimans. Now he came to emergency yesterday night with complaints of repeated bouts of vomiting, which he started having after he had a little too much to drink. Now this is the second emergency visit for similar complaints in the last 2 months. Mr. K believes that this is one time events and his alcohol use is totally under control. Now how do you screen it? So for this role play, I am the therapist and Mr. Kiran is the patient. He has come to me being referred by the emergency of Nimans. Now he had 6-7 episodes of vomiting yesterday after he took like bottles of alcohol while partying with his friends. Now he has come to me and I am supposed to administer audit on him. Okay, I hope I'm pretty clear in the situation. uh, so hi, Mr. K. What brings you to the hospital today? Hmm.
Actually, I don't know. Just like after the party, I had vomiting and all, so that's the reason they brought me to hospital.
Okay. Did it happen yesterday or today? Did you have vomiting
No,
yesterday or today?
yesterday after the party, yeah.
Okay.
So vomiting was on yesterday only. The morning
Okay.
only, I just was not feeling okay. So,
You're
but
feeling
now it's okay. Now I'm better.
okay. That's fine. That's fine. So I'd like to start by asking some questions about our alcohol use. And
Okay.
by alcohol use, I mean your alcohol use in the last 1 year. See,
Okay.
we ask all our clients standard questions about substance use, including alcohol use, because substances like alcohol can affect many areas of our lives, including our health, as you know. It
Hmm.
is very important for us to know the basic facts about your drinking pattern to plan the treatment in a better way. Okay, it will take about
Okay.
5 minutes for me to answer to ask you the questions. Would it be okay to continue?
Yes, that's fine.
Okay, thank you so much. I really appreciate you being open to discuss about it. Okay. Now, before I start with the questionnaire, I want to clarify two things. One is when I say about alcohol use or alcoholic beverages, I mean all kinds of drinks that have alcohol content in them, like the spirits, like whiskey, vodka, rum, brandy, or wine or beer, both light and strong. What may I ask? What is your preferred drink when you drink? You take alcohol?
Okay.
What do you drink normally?
Okay.
No, what kind
Sorry.
of alcohol? I am asking what kind of alcohol you drink normally.
Usually brandy, vodka, and the
Uh,
parties mix most time the time.
So you drink spirits then, or Indian made foreign liquor? Okay. In that sense, one of the questions will mention about one drink or how many drinks you do. You have to calculate according to 30 ml of vodka or brandy. So one drink or one standard drink would be 30 ml. Accordingly, you have to calculate. That is understandable and clear to you?
Yeah, kind of. It's okay.
Okay, okay. Any queries in between, you can actually stop me and ask. Okay,
Okay.
okay. So
Okay, sure.
the first question for you would be, how often do you have a drink containing alcohol? Consider the last 1 year and tell me whether it is never, or it is monthly, or it is 2 to 4 times in a month, or maybe
Um, I think around 2 to 4 times a month.
2 to 4 times in a month. Okay.
Mm.
So the next question is, how many drinks containing alcohol do you have on a typical day when you are drinking? It is 1 to 2 or 3 to 4, 5 to 6, 7, 8, 9, or 10 or more. Now, I may remind you, by drink I mean 30 ml of drinks, or 30 ml of vodka or brandy, whatever you're drinking.
In that sense, around 5 to 6 kind of thing.
On an average, you take 5 to
30
6.
ml. I don't know.
Okay, that would amount to
Yeah,
about one
5 to 6
one
pegs.
one quarter of alcohol. Is that okay? Is that am I
Yeah,
correct in assuming it?
yeah. That. Yeah,
Okay,
quarter is what I run every time.
done, done. So the next question is, how often do you have six or more drinks on one occasion? Whether it is never, or it is less than monthly or weekly or daily or almost daily. More than
Six
six
or
quarter.
more.
Yes.
Okay. Not very this thing daily and all, but yeah, I think you can say monthly.
Okay. So probably once in a month you take more than six standard drinks, or more than 1 quarter of alcohol. Am I right in assuming that?
Yeah,
Okay, great.
yeah, yeah.
Okay. So the next question is, how often during the last year you have found that you are unable to stop drinking once you have started? Whether it is never, or less than monthly, weekly, or daily.
Actually, I can control, so it's never. Yeah, that's
Okay. So it has never happened that your drinking habit, you are saying, is it under your control, right?
yes, yes.
Fine. Next question is, how often during the last year have you failed to do what is normally expected from you because of drinking? Whether it is never, less than monthly,
So,
weekly.
what do you mean by normally expected? I
So
didn't get.
let me give you an example. So let's say you had a little too much to drink one night, and the next morning, because of the hangover, you are unable to go to your office. So I'm asking about
So
that kind of
I think
questions.
in that, yeah. So sometimes after the party, it happens like difficulty to go back to the work and all. You can say less than a month.
Okay, okay. So less than a month, right? How often during the last year have you needed a first drink in the morning to get yourself going after the heavy drinking session?
No, 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 no. That never happened. I never
Oh,
drink in the morning.
you have
No,
never taken alcohol in the daytime, right? Fine.
no.
How often in the last year have you had a feeling of guilt or remorse after drinking?
I don't have anything like that. Never.
That's fine. That's fine. So the next, I have three more questions. I'll take another 2 minutes. How often during the last year you have been unable to remember what happened the night before because you have been drinking?
No, no. I remember all my parties, so it
Okay.
never
Now,
happened in.
okay. By this question, I'm asking about blackouts. You have never had blackouts. Am
No,
I right
no,
in assuming
there
that?
no, never had a blackout. Yeah, yeah, never had a blackout or anything.
Okay. Okay. So last but one question is, have you or someone else been injured as a result of you drinking? Whether it is in the last 1 year, or maybe before that, ever in your life.
Injured as in a few years back when I was riding a bike, I had an accident. I was like after the party in the middle of the night, I was just traveling. I was riding the bike, so that time I had an accident. No, only me, not no other people and all.
When was it?
I think a few, I don't remember, but not in the last year or before that. It's like few years back. I can say
Okay.
like 4 years back something.
Okay. Thank you so much. So the last question for you, Mr. K, is, has a relative or friend or a doctor or any other health worker been concerned about your drinking habit, or have suggested you to cut down on your drinking?
Yes, yes, and it's been in my family members and my wife. Everyone is saying that. Yeah, in last 1 year, every time it happens.
Okay. Okay. Thank you so much. We now have finished the assessment. I'll get back to you with your score and my recommendations for it. Thank you so much.
Yeah. Okay.
Okay. Uh, uh, Pravas sir, you have anything to say in this interview regarding this
No,
interview?
no, I just want to tell it's so nice, it's so it went so well. Also, although in spite of you in other part of the country and Kiran in other part of the country, so it went very smoothly and the questions are perfect. I think let's finish it up with it in a couple of minutes and we'll go for
Yes, sir.
discussion.
I just need to say about the interpretation.
Yeah,
After that,
yeah.
I'm finished. I'll take another 2 minutes.
Yes,
Okay,
yes.
so Mr. Kiran's score was 13. What do we make of it? So the audit score, there has been various recommendations on how to interpret audit score. I'll tell you about the two most commonly followed recommendations here. The first one was done given by the original document by WHO. It was Babar and all who has given it. This is the audit score interpretation. So if it is below 7, they say it is safe drinking. Either the person is abstinent, and if at all he is drinking in a very safe pattern. So only education about alcohol and its harmful use should be given, and it is the risk zone is zone 1. Then if the score is between 8 to 15, then it is the risk zone 2, where only simple advice should be given and the patient should be asked to follow up. Now Mr. Kiran's score was I believe 12, so he falls in this range. Score between 16 to 19 would be zone 3. So it here the intervention should be simple advice plus intervention of brief counseling and continued monitoring for development of dependence. And if the score is above 20, and the maximum score is 40, by the way, 10 into 4, so probably alcohol dependence is there, and it needs referral to a specialist treatment setup for diagnosis, evaluation, and further treatment. So this is one recommendation about the audit score. uh, the second recommendation is was given in the drink less program. It is also, it has actually, it was started in Australia, but it was a WHO collaborative project. They share a similar view, but they say 0 to 7 is low risk drinking, where feedback and education about alcohol should be given. They say 8 to 14 is hazardous or harmful drinking, where feedback and brief intervention plus education should be given. And they assume 15, a score of 15 or more in audit is indicative of alcohol dependence. So there the referral to specialized treatment or detoxification should be done. So you must remember, below 7 is safe drinking, 7 to 14 would be 7 to 14 would be, or 15 would be hazardous and harmful drinking, and either above 15 or above 19, depending upon the recommendation criteria or following, the person is likely to fall into dependence. So if a person is scoring 24, it is very likely that the person has alcohol dependence. If a client is scoring 12 or 11, it is likely that he is using alcohol in a harmful or hazardous pattern, and you need to intervene. uh, Okay, sir, I'll finish here because rest of the things have been discussed. I'll just want to mention about audit C. So as you know, audit took some time, maybe 5 to 10 minutes for us to administer. In a busy clinical setup like OPD, where a lot of people come, we might not have so much of time. So humans, they're very time efficient. So developed another shorter version of audit, or concise version of audit. They call it audit C. Audit C is nothing but the first three questions of audit scale out of the 10, and the first three questions are indicative of hazardous drinking. So if you ask the first three questions and the score is more than 4 for men or more than 3 for women, you can actually screen out hazardous drinking. And if it is above 7, then it is probably alcohol dependence. So this scale is also validated. If you don't have time, you can actually use audit C also. The take home messages for this is that the opportunity for screening and early detection and brief intervention for alcohol disorder exists in many treatment setups, not only in hospitals. Use of audit is the first stage of treatment, and the audit score be utilized or should be used to actually plan out further interventions for the case. Easy and culturally appropriate screening tools, which also guides about type of intervention, is audit. So audit can be used everywhere in every population. There is no bias in that. These are few documents that you can go through to learn more about audit. Now audit can be a self administer, can also be a physician administer or therapist administered scale. There are many online websites that actually also give the facility of screening audit for yourself. You can google it and actually find it out. I finish it. Thank you.